Hi, I'm Dr. Lisa Lilienfield from Kaplan Center for Integrative Medicine. Today I want to talk about allergies and mast cell activation. What they do have in common is histamine. Mast cells are important cells that are part of our immune system. The histamine actually protects us from invading bacteria, viruses, environmental toxins, allergens, etc. But for susceptible individuals, this histamine can produce a lot of unpleasant symptoms such as runny nose, congestion, cough, maybe even asthma, itchy skin, itchy eyes. The conventional treatments have been antihistamines, nasal steroids, cromolyn to stabilize those mast cells, and bronchodilators for those that have asthma. At Kaplan Center, we often see something more complex called mast cell activation. This is where the mast cells go a little wonky and overproduce histamine and other inflammation factors. There's usually a reason why these mast cells are hyperactivated. That can be from mycotoxin or mold toxicity, or Lyme disease, or other co-infections, or other viruses or bacteria. The symptoms of mast cell activation can be all the symptoms I mentioned previously that are for allergy, but also can include digestive issues because we have histamine produced in the digestive tract, so it can present with reflux, abdominal pain, diarrhea, also fatigue and headaches, and a feeling of being attacked. Symptoms can be quite severe. The diagnosis of mast cell activation is difficult because the testing is very time sensitive, and one has to be tested by urine or blood at the time of a flare, and that's not always possible. So typically we diagnose and treat on the clinical basis. So the treatment of mast cell activation is using H1 blockers like antihistamines, also H2 blockers that are antacids like Pepcid and Tagamet that decrease the histamine in the digestive tract. In addition, we use natural agents such as quercetin and paramine. We use DAO, which is an enzyme that breaks down histamine. Pharmaceuticals include gastrochrome, which is cromolyn, that is a mast cell stabilizer, ketotifen, which is also a mast cell stabilizer that's made at a compound pharmacy. In addition, we suggest a low histamine diet because a lot of foods such as tomatoes and peppers, alcohol, chocolate can have histamine, and foods that are left over increase in histamine. So working with a dietitian if one suspects mast cell activation is very important as well. So we always look at a potential cause such as mold toxin exposure or Lyme disease if appropriate, and we have tests to check for those things. Mast cell activation can sometimes also be associated with complex conditions such as Ehlers-Danlos or postural orthostatic tachycardia syndrome, but that's a discussion for another day. So if you suspect that you have mast cell activation or someone you love, please give us a call at Kaplan Center. Thank you.